Finding that you have low testosterone in perimenopause or menopause is a really common finding, but it definitely begs the questions by my patients and students, what do I do with this low testosterone? Is something wrong? Do I need to do anything about this? So in this video, we're going to talk a little bit about what happens to your testosterone levels, what it means, and if you need to treat it. So if you're interested in that, definitely stick around. Hi, I'm Dr. Hirsch. I lead the menopause clinic here in Boston and see patients at the Brigham and Women's Hospital. Now, a big question I get is about low testosterone, so let's get right into it. So women make testosterone just like men do. It's just that we make about 100 times less. We don't need very much to make a big difference. Now, there's a lot about testosterone that we don't know. I really wish that we knew more. It probably has a lot of functions in the body, just like estrogen does, but testosterone really is important for libido and sex drive. Now, what is the reference range for a normal level of testosterone in a female? Well, reference ranges are important because they can always be a little different. The one that I use is a testosterone level between 2 and 45. Now, as a side note, this is interesting because my reference range used to be 8 to 60, but just know that anywhere under 50 is probably the upper limit of normal for physiologic or normal levels of testosterone. As women go through menopause, our ovaries, which make our estrogen and pretty much most of our testosterone, pretty much retire, and those levels decline. So it's really common that postmenopausally, when it's been a year of no period, you have an elevated FSH above 35 on 2 separate occasions and low estrogen, that your testosterone is also going to be low. So usually I see it under 20. Now, every once in a while, I will see patients on opposite extremes. Certainly I see a lot of patients for whom it's 0 or what my lab says is undetectable. Some women actually make a good amount of testosterone. They may have a level of upwards of 40 or 45. Now you might say, why is that? Shouldn't they have low testosterone? But the adrenal glands can make some testosterone. And so it's actually a little bit of a sign that there's a stress response on the body and that your adrenals are secreting testosterone in response to a stressor. The stressor, in my opinion, is probably the symptoms of menopause, but that tends to explain why very few women actually have normal or elevated levels of testosterone. But what I want you to know is that the majority of women will have testosterone levels in that lower 1/3 of the reference range. So about, 17 or less. So what symptoms does that cause? Well, for the majority of women, it's really a change in libido. And libido is really desire, thinking and having spontaneous thoughts of sex or sexual fantasies. Now, this can be very problematic for some women and for many different reasons. Now, for many women, they actually say, I really love my partner. I find him or her extremely attractive, but I just don't want to be sexually active. I'd rather read a book or make dinner together. And that's really common, but then can be frustrating for women when they know that that intimacy is really important for their relationship. So low testosterone can have an impact in libido. Now, we don't know what we don't know about testosterone. So does it impact the rest of the body? Well, the short answer is, again, we don't know, but probably. So there are very, very small studies that show testosterone is important in cognition, in brain function, in bone health, and probably in many other things. Again, we just don't have enough information to know. So if your testosterone is low, you don't have to actually replace testosterone, and it doesn't mean that anything detrimental is going to happen. Now, certainly we have evolved into a longer menopause, but throughout all of evolution, women have probably gone into menopause. And so we have had lower testosterone levels as we age for decades, going all the way back to probably when we were created. But it can create problems now since we live 1/3 of our lives postmenopausal. So again, it begs the question, do you have to treat a low testosterone? No. Does it mean anything's wrong with you or it's going to be any risk factor? Not that we know of, no. But some women do want to treat their low testosterone because primarily they have low libido as a presenting problem. Hypoactive sexual desire disorder is actually the medical term for low libido that is bothersome to women. So you can have just low libido that's not bothersome to you or your partner or your lifestyle if you're single, and it's not necessarily a medical condition by any means. But if you have low libido that is bothersome to you, that's called hypoactive sexual desire disorder. And if you combine that with a low testosterone level, that means that actually maybe we might want to consider treating you with testosterone. There's many ways to use testosterone, but NAMS, the North American Menopause Society, and ISHWSH, the International Society for the Study of Women's Sexual Health, I know they're both a little bit of a mouthful, recommend the use of low-dose topical physiologic replacement of testosterone levels. What this means is typically in a compounded gel or commercially available testosterone in a very, very small physiologic dose for women. It's popular, although not recommended specifically by me to do injections of testosterone pellets. I did a whole video here, and you can see I am really against it. And the reason is because you can have super therapeutic and dangerous replacement levels of testosterone that are not needed. Remember that the reference range of testosterone for women is 2 to 45. When people get pellets injected, they're giving themselves massive levels of testosterone, upwards of the 100s and 200s, and that causes side effects from testosterone replacement. So me, NAMS, and most evidence-based providers will recommend low-dose physiologic levels of testosterone. Now this has to be compounded, even though I don't recommend compounding any of your hormones. You have to do it for testosterone because it's not FDA available in a commercial product that I can prescribe for women. So then that begs the question, what are the benefits of testosterone replacements? Well, I usually do a replacement trial for about 6 to 8 weeks. And what I'm looking for is improvement in the following issues: libido, which is the main reason to prescribe it. And I look to see if they have any improvements in other things like memory, cognition, metabolism, or muscle mass, sometimes even energy. Now, I would definitely not prescribe testosterone as first line for any of those issues. I would primarily prescribe it for postmenopausal women or women in the perimenopause transition who have low testosterone levels, who report low libido. But again, we don't know what we don't know about testosterone. I want to go back to my original point that just because your testosterone is low, you do not have to do anything about it if you're not experiencing any of those issues. And the next thing I will say is that the majority of women who use hormone therapy, which is an estrogen plus a progesterone if you still have a uterus, actually find that this solves most of their problems and actually won't need to go on to use testosterone. So it's a very individualized decision, and it's very fun for me as a clinician to help a woman make that decision. But what I wanted to address in this video is that low testosterone is normal throughout the menopause transition. No, you don't need to treat it, but if you do have low libido, it is a good time to consider testosterone replacement if your T is low. I hope that was really helpful. I think this is a really common question that women have and something that I get asked every single day in my clinic. I do have other videos on low libido and the medications for low libido, and I'm gonna link that here. I find this to be a really helpful video, and I'm excited to make more videos for you on this topic. Drop me any kind of comments or questions below. What I did not address, what questions do remain, what you still wanna learn about. Please subscribe to the channel if you haven't already. Many of you watch my channel and haven't subscribed yet, so if you do, that tells the YouTube algorithm that this channel is really helping women who are looking for information on all things perimenopause and menopause, and I will appreciate it from the bottom of my heart. Thank you guys for supporting my channel so much, and I will see you next week for a brand new video. Bye everyone.